Hello, my name is George Wanamaker. I'm one of the physical therapists at Presbyterian Village, and this is a continuing series on back care and maintenance. What I'd like to talk about today is more of the middle back. So I borrowed these pictures from Google, just Google searching, but the middle back is not quite an area that gets as much attention. It's more the low back and the neck region. However, there are some very, very specific conditions and changes that can occur to the middle back. Hopefully you can see my cursor here in the picture, but the middle back is called the thoracic region. It goes from, approximately your clavicle area, again, approximately, and then down a little bit above the top of your hips, not quite as far to the top of your hips, but in this picture, hopefully you can see it's highlighted in more of a yellow color. The thoracic region is interesting because it's different anatomically pretty significantly from the cervical region, which is the neck, and the lumbar region, which is the low back, which are essentially very similar in structure, just the lumbar is much bigger than the cervical. The thoracic is very different. One, because of the different muscular attachments, but two, because of the ribs. Your ribs attach to the thoracic spine and house your vital organs, your heart, fat deposits, a bunch of different other structural elements and vital elements. But there's also a lot of supportive muscular attachments that are important for posture. So there are the same elements as in the rest of your spine. There's the vertebra, which are the actual bone, the structural elements, and then between the vertebra, there are the discs, which are more fluid-like. However, they have encapsulated a tough fibrous outer structure that maintains the integrity of the discs, but the discs allow for movement. Between each of the vertebra, you have joints, and uniquely within the thoracic spine, you have rib attachments and rib joints. The ribs can actually move a little bit in and out. If you think about it, hopefully you can see my chest. When you're breathing, you're expanding and your ribs have to do a little bit of movement, and then your elastic recoil, you're coming back to this position. Your ribs have to very slowly, well, not necessarily slowly, but very subtly have to move. So those joints are very important. And if your ribs are damaged, you can actually in turn damage the spine. So another consideration is the muscular attachments and posture. Particularly up here higher in the mid-back region. If you have poor posture, it can impact the actual structure of the spine, leading to long-term changes that are difficult to maintain and improve. The other thing to think about is having enough nutrition, particularly for postmenopausal women, having enough vitamin D, vitamin B12, and certain other things, as well as daily mobility and activity. Now, you might say, well, when I walk for a long period of time, my back hurts. However, you need that upright position, one, to maintain your postural control muscles and improve your ability to strengthen everything upright, but two, also so you can reduce the pressure and the tension to these structures. It's going to be worse if you just are sedentary and sit for prolonged periods of time versus just biting the bullet, trying to stand, trying to stretch, and making good conscious daily habits about it versus doing it every once in a while and then feeling the discomfort. So let's move on from the basic structure. This picture is just sort of illustrating more in depth the actual integration between the thoracic spine. There's the rib cage attachments. The ribs mostly have two attachment points to your spine. So that's why if you damage a rib, it can actually impact multiple levels because there's two attachment points. However, down lower, about level 9, there's only one real attachment, and then lower, usually these lower ones are considered what they call false ribs, where they're ribs, but they don't have a frontal attachment point to, they're more floating. But as you can see, there's a close integration between the neck, between the lumbar region, the rib cage, and as I'll show you here in a second, there's lots of supportive musculature layers that are important for posture. So let's jump ahead to that, wherever my muscle attachments are. Here we go. This looks like a mess, and it's because there are very specific muscle layers and attachment points that all have different roles within the body. The thoracic region is really, if you can see the scope on my cursor, from about this top point down to about these lower musculature here. But as you can see, there is a lower, this on the right hand side would be considered a lower layer. This is very closely approximated to the spine, and there's supportive musculature going up the whole length of the axis of the spine, but there's also other supportive musculature attaching longitudinally, to other attachment points that are very important in posture, in dynamic movements, in rotation, that can become strained or irritated, particularly if you're lifting something heavy, or you're not using good body mechanics when you're lifting, or if you wake up and turn all of a sudden, you may strain or irritate some of this musculature, that can then impact your spine. This is another picture of the basic thoracic spine vertebra. You have your actual vertebral body, which is where the discs sit on top. You've got a central canal here, which is important for your spinal cord. And then you've got other muscle attachment points. And then uniquely, you've got the attachment points of the ribs with the vertebral body, which allow for very, very subtle movement. So you can move your chest in and out, you can turn, you can do different things. Let's go back to the actual picture of the spine. So I mentioned some dietary changes like vitamin D, vitamin B12, and other important things, and the importance of posture. What can actually happen is, as you age, if you have a lifelong history of excessive stress or any kind of trauma, it can lead to actual structural changes of the back. So a normal healthy spine has these basic curves. And what can happen is, as we lose our ability to maintain our upright posture, whether it's a weakness up here in our neck, contributing to forward movement of gravity pulling us forward, it can lead to actual structural changes here in the mid-back region, exaggerating this curve to something called thoracic kyphosis. This can naturally occur over time, but it can be exaggerated by having poor posture, having poor diet, things like smoking, the nicotine. Your body has certain receptors called nicotinic receptors that the nicotine actually elicits a reaction and leads to poor blood flow and increased blood pressure and other issues that can actually contribute to the degradation of the spine, so structural changes. Not using an appropriate assistive device, like being resistant to using a walker or some other supportive device when you really should, to help with your posture and to support your muscles that may be weak. Sometimes that's more of a vanity thing, but if you're not using appropriate walker or a cane or something, when you really should, it can lead to actual structural changes over time because your body and your muscles can't support your posture and the force of gravity over time. There's some natural changes that occur with your body over time with weakness, that it can't support the spine in a more upright position. So this is a condition called kyphosis. This is fairly common. There are some things you can do to improve this, strengthening the musculature. Where's my muscle picture? Strengthening the muscles at the top of the spine, particularly up here, some of these big supportive muscles like the scapular supportive muscles, and some of this other stuff to keep your head more upright, keep your body in better alignment. Being conscious of posture can help. So there's also an exaggeration called kyphosis or scoliosis. This, in my experience, it tends to occur more in females because of some of those postmenopausal changes with diet, with hormone levels. But what can actually happen, particularly in the thoracic spine, the mid-spine region, is you can get an actual curve of the spine. I realize this is not a great picture, but hopefully you can appreciate the curve. So this would be a normal, trying to pull it up. This would be a normal, healthy spine. There's good middle alignment. But what can happen is there develops a curve over time, whether there's a damage from like a compression fracture where you've fallen and you've damaged the spine and the actual structure has been compromised, or over time by not having enough of the proper minerals or the activity of the cells of the spine, the minerals are not deposited as well, so they can lead to changes over time too. It can happen in the lower back region too, and then can be exaggerated throughout the length of the spine, where there's more of this S curve. So what can happen, and what we see a lot, is there will be sort of a double up of these issues, the scoliosis and the kyphosis, leading to something called kyphoscoliosis, where essentially it's a combination. So there's an exaggeration of the spine's normal curvature, so the forward to back axis, but also there is more of a lateral curve going on, which that can lead to some other issues like shortness of breath, chronic pain to the mid-back region, difficulty with breathing, with blood pressure, with other regulations of normal vital functions, because the spine can't maintain that upright posture. Some things that would help are using a walker or something to keep your body upright. Sometimes there's some bracing or some soft supportive compression sleeves or something like that that can help maintain the alignment a little bit better. And then just being active, being not sedentary. A lot of these changes occur because of somebody is sedentary, where gravity is constantly acting on our bodies. Gravity is never not acting. And if you're in a sedentary position for a long period of time, particularly sitting on a couch or a sofa or a chair and flexed, that force of gravity is constantly applying an axial force through your body, putting pressure on your bones. And eventually those bones, through being sedentary and through not having proper diet and proper mobility, can break down. I've had patients where they never even had a single fall, yet they result in a fracture to their spine just because they're either inactive or they just don't have the proper diet or the proper posture to support their spine. So being conscious of some of these changes. Stretching. Stretching is very important. There's lots and lots of benefits of doing yoga type activities. Tai Chi has a lot of evidence behind it, but it doesn't even have to be a standing activity. There's luckily at a facility or a campus like Presbyterian Village, there's lots of options like seated Tai Chi. seated chair yoga, seated chair stretching, other avenues to where you can still stretch, you can still work these postural control muscles. Sorry, I'm emphasizing my posture. But if you don't have good balance, you can still work on these things in a modified position. A lot of it is just taking active strides to be conscious of what you're doing during the day, the benefits of mobility, important dietary habits, obesity, or even being overweight has an impact on your spine. Gravity is constantly pulling on everything. And if you've got more mass, therefore, that force is multiplied, putting a lot more strain to your spine. So just making healthy, conscious life habits is important. So again, we're talking about the thoracic spine, the mid-back region. So I'm coming back to this picture to illustrate that there's not one particular muscle in the back that, oh, I strained a muscle. These muscles work together, and there's a deep layer of muscles that are closely integrated to the spine, but there's also a bigger supportive, more important in posture. That's not exactly true, but more important in posture, superficial layer of big supportive muscles. And sometimes this stuff just needs to be stretched. So I keep coming back to the fact about not being sedentary, taking advantage of the wellness classes available, stretch and flex, chair yoga, Tai Chi, chair Tai Chi, all these other important things that are good for stretching and posture and breathing that will help support the spine. Oh, I forgot I had this picture. So this picture sort of illustrates the rib attachments. So as you can see, the ribs attach in the back portion of the spine, and they come around in the front, and most of the way down, they have your sternum, your front bone, the hard area in the front attaches right here. And then there's cartilage attachments and joints. But it's very important to understand the integration between the ribs and the spine, especially in the middle region, and the importance of good upright posture, because there's constantly forces pulling on these muscles and straining them. So that's probably about it for today. Let's go back and talk about things you can do. So I already mentioned you can do chair yoga, you can do chair Tai Chi. If you're able to and have good balance or good strength, standing Tai Chi is an excellent avenue for working on postural control muscles, breathing, that sort of thing. Stretching, even if it's just large scale movements, like I call it like the sunrise movement, where stretching overhead and large scale movements to really stretch and get your posture upright. Being active, walking if you're able to, even though walking can be uncomfortable initially, if you are diligent and you work on your standing posture, your breathing, working on your progressing in distance, making certain milestones and being proactive during the day, the act of walking gets easier because you're working these postural control muscles, you're working your breathing, your cardiopulmonary system, but you're also allowing for proper loading of these bones to improve the mineralization. Bone is funny. Bone, there's a phenomenon called Wolff's Law. And Wolff's Law essentially entails bones responding to stress. So even though you may have hormonal changes or dietary changes, bone responds to stress, and it needs that force, that loading, as sort of an initiation cue to the bone cells that are left as we age to continue depositing minerals. This is a far-fetched analogy, but astronauts. So astronauts in space lose bone mass very, very quickly because they don't have that gravity and that constant force providing that pressure and that cue to the bone cells to continue depositing minerals. So what astronauts have to do in space is they have to have, I think it's like a 2-hour a day workout regimen to maintain the loading of those bones, to maintain those forces, so that even without the force of gravity acting on us, you can still maintain the bone health. Because there used to be a big problem where astronauts would come back and their bone density had significantly depleted. These are even, 30, 40-year-old people who are very, very strong, very, very active, are having these severe changes, but they realize that, okay, activity is important. Loading of the bone is important. Resistive activities is important, because your bone, in order to maintain good health, needs these forces, needs these proper diet too. But it's very, very important to stay active. And so that's the point I'm trying to highlight, is activity, stretching, loading, but having good posture while doing that, whether it's using a cane or a walker or something that's supportive enough to maintain your posture, is essential. So that's it. That's all I'm going to talk about today. Again, this is more about the mid-back region. I'll talk more in the future about some stuff you can do for the mid-back region. There's not quite as, we typically in physical therapy see people for their neck pain or low back pain. We don't quite as often see the thoracic, the mid region. However, we do, and it's important to highlight the thoracic region because there are some significant structural changes that can occur, like the kyphosis, like the scoliosis, the actual changes of the normal curvature of the spine that can occur, that you need to be aware of and be conscious of things that you can do to help reduce some of these things. Again, gravity is acting on us constantly, and we are aging. From the time we are conceived to the time we die, we are constantly aging, and different forces and different medical conditions and metabolic changes are constantly acting on us. But if we're more conscious of our health, more conscious of our diet, our weight, our activity level, stretching, some of these things, we can give ourselves a better chance to maintain longevity, maintain the health of our spine. So again, my name is George Wanamaker. I'm one of the physical therapists at Presbyterian Village, and this is a continuing series on back care and maintenance. Thank you.